So chronic sinus disease surgery, endoscopic sinus surgery, is a minimally invasive surgery. We basically use endoscopes, which are small cameras, to perform that surgery through your nose. We make no cuts on the outside of your nose, on your face, or anything like that. The whole point of this surgery is to do a kind of a major renovation inside of your nose to optimize medical delivery. When you undergo this procedure, you will undergo general anesthesia. So what is general anesthesia? Essentially, general anesthesia to you means just going straight to sleep. They use either medications through your IV, intravenous, or inhalation through a gas. Once you're put to sleep, the anesthetist will put a tube through your mouth to ventilate your lungs with oxygen. And while you're asleep through the entire procedure, they'll be taking care of all those important essential vitals, such as your heart rate, your oxygen, your blood pressure, etc., through that whole procedure. So you might be wondering, how safe is this procedure? And you'll be quite surprised, it's actually quite a safe procedure. As you're aware, you took that CT scan before surgery that helped us make the diagnosis of chronic sinus disease. Now what we can do with that CT scan is take it into the operating room and calibrate it with the instruments we use. This allows us to be safe between your eye and your brain. Now, there are though potential complications when dealing with any type of surgery. And with sinus surgery, the risk of injury to any of those structures can range from about 1 in 1,000. Now, I'm not particularly concerned because we're so used to working in this area. Now, if we do cause any kind of injuries to your eye or your brain, we are all trained on how to manage those scenarios. Soon after surgery, you may wonder how you're going to feel. I tell most patients to take approximately 1 week off. And the reason for that is that you're obviously going to feel quite tired from the general anesthetic, but you're also going to have some effects from the surgery that I performed on you. More of the common symptoms that patients tend to feel is a lot of congestion and pressure. Those symptoms tend to be alleviated with a lot of nasal irrigation. In my practice, I ask patients to irrigate their nose 3 to 4 times a day, and this can vary depending on your surgical provider. So you might be wondering how to manage your pain. You'll be actually quite surprised the majority of patients manage their pain with simply Tylenol and Advil. Now, if you're struggling to manage your pain with such medications, you may ask your provider for some stronger medications. Soon after surgery, do not be surprised if you have some bleeding. Bleeding can last for about 1 to 3 days after surgery. Now, usually it's more spotty bleeding and bleeding associated with your irrigation. However, if you have a lot of bleeding and that's uncontrollable, despite just with your irrigations and spotty bleeding that just comes out of your nose, definitely call your provider for some help and some suggestions. One of the symptoms that chronic sinus patients have is a loss of smell. Even actually some patients who undergo sinus surgery have a normal sense of smell. And a lot of people wonder what their sense of smell will be after surgery. And to be honest, we just don't know as surgeons. I have patients who have a normal sense of smell that have a short course after surgery where their sense of smell depreciates and then comes back. I have some patients, unfortunately, that have a normal sense of smell and their sense of smell seems to be diminished after surgery. Now that's a small group of patients, but it's possible. And then I have patients who have no sense of smell before surgery and have a dramatic improvement with their sense of smell after surgery. So as you can see, it varies between patient to patient. Now what I can reassure for you is that the way we do perform surgery is to ensure all that special tissue inside of your nose that gives you a sense of smell is preserved. So you're wondering, you've undergone surgery, you recovered, will you ever have to go through this again? Unfortunately, this is one of those conditions which we call chronic sinus disease, and there's a percentage of patients, approximately 20, 30, sometimes even up to 40% of patients who do have recurrence of this disease. Now, some of those options in managing recurrence vary. Some is more medical options and some are surgical options. And those are discussions that you must have with your surgeon on how to best manage your situation of recurrence. Now you might be wondering about follow-up after surgery. Well, definitely you're going to have one right after surgery just to clean out your sinus cavity, take out any packing that might be in your nose, and just to make sure that it's healing properly. Now we basically function like dentists. Now obviously you go see a dentist to ensure that you don't get cavities and prevent disease. Well, that's what you see us for after surgery. You come see us on a regular basis to ensure that disease doesn't come back.